Good afternoon and welcome to Cook County Health's discussion on summer safety. We're so glad you are joining us today. We know summer brings a lot of fun, but it can also bring some unique risks. Today we're covering it all with some helpful advice from the people who keep us healthy. I'm Kate Hedlund, Director of Public Affairs at Cook County Health, and I'm honored to be joined by this wonderful group of panelists. Before we begin, this is an interactive discussion. If you have any questions about summer safety, please send us a message below. Now I'm going to have everyone introduce themselves. Dr. Joshi, let's start with you.
Thanks so much, Kate, and greetings to all you viewers out there. I'm Kiran Joshi. I'm Chief Operating Officer of the Cook County Department of Public Health. We're the health department for suburban Cook County, and I'm also an attending physician with the Department of Family Medicine at Stroger Hospital.
Dr. Schindelbeck.
Hi, good afternoon, everybody. My name is Mike Schindelbeck. I am an attending physician in the Department of Emergency Medicine at Cook County Health. I've been an emergency doc here for 20 years and also the residency program director. So I'm in charge of the training program for all of our emergency medicine residents here.
Fantastic. And Dr. Poulakidis, last but not least.
Thank you. Hello, my name is Stathi Poulakidis. I'm the director of the burn unit at Cook County Health. I've been here also for 20 years, and it's a pleasure to serve the community, and I'm honored to be on this panel of very distinguished individuals, so thank you for having us.
Dr. Poulakidis, we're going to stick with you for the first question. This week is July 4th, and we know that can be a busy time in our burn unit. What are some of the frequent injuries people experience when it comes to the holiday and the summer months in general?
Unfortunately, with the 4th of July, obviously everybody's circled around the table with fireworks. First, let me highlight that fireworks are illegal in Illinois, so we would never want to obviously advocate for fireworks, but we understand that people are bringing them over the border and they may have them in their possession. Some of the things that we worry about is people using drugs and alcohol while actually working with the fireworks. And what happens is when that happens, their judgment's a little bit faded. And what ends up happening is they either have burns to their fingers or face or chest, or worse, they actually have firework blast injuries where they lose fingers or have, devastating life-threatening injuries. And so we just want everybody to enjoy the holiday and try to avoid that. I guess the biggest thing that we see a lot of times is, everybody thinks that sparklers are very innocuous, but they burn at 2,000 degrees Fahrenheit. And a lot of people want to hand those to the babies or the little ones in the group of, while you're having fun. And those are one of the things we want to try to avoid because they burn so hot and can injure the children very badly.
Absolutely. Dr. Schindelbeck, we've had an extended stretch of hot days this summer, and that can be tough on the body. What are some things people should be looking for when it comes to heat-related illnesses?
Yeah, thank you. I think first and foremost, you have to really listen to your body when it comes to heat emergencies. So signs that you might be experiencing the early stages of heat exhaustion. Excessive thirst would be the biggest one. Honestly, if you're feeling really thirsty, you're probably already quite a bit behind on your hydration. So listen to your body on the thirst. Excessive sweating, you might notice somebody has really cool, clammy, pale, really wet skin would be a clue as well. You might start to generate some neurological symptoms. Headaches are an early one, muscle cramping. Those are all early signs of heat exhaustion. And then as the situation gets worse, you might see individuals who develop more neurological symptoms. Nausea, vomiting are kind of common findings, along with what we call a decreased level of consciousness. People will be confused, disoriented, or might even look just drunk in appearance. Those are all very concerning signs. And if you see that, you need to act very quickly.
Okay, Dr. Joshi is kind of sticking with the theme of being outdoors. Can you talk about some of the illnesses that we can kind of, catch in nature, like West Nile illnesses related to tick bites? And what are we seeing in Illinois and here locally in Cook County?
Thanks so much, Kate. So West Nile is really the most common mosquito-borne illness in the United States. First began seeing it, for those of you who may recall, in 1999, and it's really only increased across the country, and that includes suburban Cook County. So last year in suburban Cook County, we recorded 19 cases of West Nile and 5 deaths. So this is very serious. It's the highest number of West Nile virus deaths in our region since 2018. And what's more concerning is that it's really tough because there are no vaccines to prevent West Nile. There's no medicines to treat it. It's really about supportive care. Now, I will say that most people who get infected with West Nile don't get sick, or rather, they don't feel sick, but 1 in 5 can develop a fever and other symptoms, and 1 in 150 can develop something called West Nile virus encephalitis, which is really serious and sometimes fatal illness. So this is most common in people over the age of 55 and folks with weakened immune systems. For those populations, for those communities, we really want to take measures to prevent West Nile. And I'll talk about some of those tips in just a little bit. I do want to make folks aware that we inform the public on a weekly basis about where we're seeing we do testing in collaboration with mosquito abatement districts across suburban Cook County of pools of mosquitoes. And you can find that data in your local community, what pools are testing positive. And you can go to fightthebitecookcounty.com for that information.
Great. And what are the symptoms? You talked briefly about it, but what should people be looking for?
Yeah. So again, most commonly, you may not have any symptoms at all, but you can still sort of be involved in that chain of transmission. So it's really important to take measures to prevent West Nile virus, like using a good bug repellent. But you could have just mild symptoms like a headache or slight fever. Again, we do get most concerned about individuals that are over 50, 55, people with chronic conditions like heart disease or cancer, all at higher risk of those severe symptoms, which can include a fever, things like a stiff neck, headache, confusion, and potentially even inflammation of the brain, which can be fatal. So symptoms could appear anywhere from 3 to 15 days after you've been bitten. You can learn about this and again, get more tips to prevent West Nile at fightthebitecookcounty.com.
Great. Dr. Schimmelbeck, coming back to you. When should people seek medical attention when it comes to the heat?
Yeah, it's a great question. So, earlier I talked about some of the early findings you see with heat exhaustion. You start to get very sweaty, really thirsty, maybe some muscle cramps. That's when you need to get out of the heat and really start trying to drink as many fluids as you can and cool off. So get to a cool setting. Beyond that, if you notice somebody who starts to have, again, some of the neurological symptoms where they're confused, disoriented, again, look intoxicated. If you notice that somebody goes from looking cool and clammy in appearance to very dry, they're no longer sweating, they look very red and flushed, then you're actually transitioning into heat stroke, and that's a medical emergency. So you need to get medical attention right away. That's when you should call 911 and get that patient to an emergency department.
Dr. Poulakidis, regarding, you mentioned before about sparklers. Can you talk a little bit more about why those can be so dangerous?
Sure. The key is that they seem so harmless and everybody wants to pass them off to the children, but they can burn up to 2,000 degrees Fahrenheit. And when that gets into a child's hands, some of the sparks can actually cause them to drop it. And I've seen kids dropping onto their feet and end up sustaining very severe burns to their feet, which actually could burn almost down to the bone. And so that's really kind of the danger mark with the sparklers. The other key is they're not on the do not use list in Illinois, and so they're actually readily available at your common grocery store. And so there's ease of accessibility to them, which makes it even that much more dangerous because you think, oh, hey, it's safe. I'm going to just kind of bring it over to the regular holiday party. And that just adds to the danger of everybody kind of thinking that they're actually not going to have any harm or risk associated with them.
Yeah, true. Dr. Schimmelbeck, going back to you, are there certain groups that are more vulnerable to the heat? Like if you're taking a certain kind of medication, does that make you more likely to experience, issues related to, the heat?
Absolutely. So the groups we really worry about are individuals at the extremes of age. So infants and toddlers, and then the elderly are at increased risk. Also, those individuals with chronic medical conditions, heart conditions, lung problems, asthma, emphysema. It's really somewhat easy to see when individuals come in an outright heat stroke, and we can say this is a heat emergency. What we probably under-recognize and underappreciate is all of those individuals with these chronic health conditions who come in not with heat stroke, but my asthma is really bad today and I can't figure out why, or my heart failure is not responding to the normal medicines. And that's also exacerbated by the heat. So we really worry about individuals with serious underlying medical problems. And then there's certain medications that definitely can predispose you to developing heat stroke. Some common ones, over-the-counter cold medications, allergy medications can do it. Individuals on blood pressure medications and those on medications we call diuretics, or commonly known as water pills, in the community, those can dehydrate you and put you at increased risk for heat stroke. And also individuals taking certain psychiatric medicines, those for depression or other psychiatric issues, or stimulants, those individuals on medications for conditions like ADHD. All of those medications can put you at increased risk for developing signs and symptoms due to heat exposure.
So would your recommendation be that we try to keep those people should, be very cognizant and kind of stay indoors in this kind of weather?
Absolutely. I think everybody needs to be cognizant of the heat and take it seriously and try to avoid being out during the peak time during the day when it's the hottest. But especially those individuals with chronic underlying conditions need to be very wary and plan ahead and try to stay out of the heat. Yes.
Dr. Joshi, going back to you, what precautions should people be taking to protect themselves from West Nile?
Yeah, so this is something I alluded to in my earlier comments. The absolute best way to protect yourself from mosquitoes and ticks, by the way, is to wear an EPA-registered bug repellent. So DEET is safe when used properly, and it's effective. And repellent containing 20 to 50% DEET is great for adults. Child-friendly repellents have a little bit lower percentage. 20 to 30% is just fine for children. If you do have concerns about DEET, you can use other EPA-registered repellents that include things like picaridin. This is less greasy. People often don't like the feeling of DEET on their skin. So picaridin is a good option, but it is a little bit shorter lasting. Another option is oil of lemon eucalyptus. There is some research that supports the use of that in terms of repelling mosquitoes, but it just, I have to be honest there, it does not work as well. On children that are younger than 3, we advise you not to use repellents containing oil of lemon eucalyptus or things like para-menthenediol. I know that's a long word, just wanted to get that in there. And then just some really simple kind of like basic tips to keep in mind when you're using bug repellents. First of all, in the summer, make sure you apply your sunscreen and make sure you apply it first before you apply the bug repellent, because the two can kind of interfere with each other if you apply the bug repellent first. You always want to apply the bug repellent on skin that's going to be exposed or on top of your clothing. You never want to apply it underneath your clothing. And the reason for that is if you apply it underneath, it can be kind of irritating to the skin, and we don't want that to happen. This seems like it's obvious, but you never want to apply it directly on your face. You don't want to inhale it because it can cause problems in your lungs. Always better to spray some on your hands and then apply it to your face that way. Finally, after you return indoors, you want to wash the DEET off and clean your clothing with soap and water.
And I imagine we want to be careful about standing water in our backyards or where we're at.
Absolutely. So this is something that we also speak to communities about, which is really working on draining the standing water around your home. Mosquitoes can breed in really small amounts of standing water. So things like bird baths, things like, a rubber tire that may be hanging out in your backyard. You want to make sure that no water collects in those areas. They can really help reduce the amount of mosquitoes that are in your immediate surroundings. If you have window screens and you're somebody who leaves the windows open during the summer, please make sure you repair any torn window screens to avoid mosquitoes getting into your home. And then be really careful about particularly wandering around or hiking or playing outdoors during dusk and dawn, because this is when we've got the heaviest levels of mosquito activity in the outdoors.
Great. Dr. Joshi, changing the subject a little bit, but nationally, we're still seeing cases of measles. Can you talk about what we're doing here locally?
Absolutely. So we are certainly concerned that measles is spreading. I also want listeners or viewers to be aware that measles is very preventable. So 97% of people who developed measles this year were unvaccinated. Vaccination is the best protection against measles, and 2 doses of the MMR vaccine, which is the measles, mumps, and rubella vaccine, provide 97% protection and generally provide lifelong immunity. I can't overstate the importance of MMR vaccination in particular as a life-saving measure. So looking back over the last 50 years, the MMR vaccine has been estimated to save 154 million lives globally. So it's really just a shame that we're experiencing the single largest outbreak in the last 25 years, primarily because of under-vaccination. We are looking very closely at vaccination rates in suburban Cook County, and we've seen kind of like this slow, steady decline in childhood immunizations overall, and in measles vaccination specifically. We are still in that safe zone for community immunity or herd immunity, but that's something we need to work to maintain. We can't take that for granted. And so we're working really hard to address things like misinformation, which we know in this age of widely available social media is only spreading, and also making sure that people have access to immunizations. So we have a community immunization program that is going to schools and administering vaccine in areas where it's really hard to access that critical primary care service. We're also doing an awareness campaign. We've been debunking myths and sharing information on all our social media platforms and our website. So again, would really encourage people to check out cookcountypublichealth.org for more information.
Great, thank you. That's important information. Dr. Poulakidis, going back to you, how can people treat a minor burn at home, and when should someone go to the hospital to seek treatment?
Sure. Thank you, Kate. That's a great question. Minor burns are going to be almost like a sunburn. It's going to be obviously cleansing the wound. We're very big on soap and water and making sure that the wound is washed. I know a lot of times, you go to somebody's primary care, doc in a box kind of facilities, and they'll tell you don't wash the wound and leave it in a bandage for a long time. We're completely against that. We want to actually wash the wound, get soap and water onto that. You can use some of the topical antiseptics that are over the counter, and then obviously triple antibiotic is something that's very easy to achieve over the counter, and you can treat some of these minor burns over the counter with some very simple remedies at home. Once the burn starts to blister, we recommend that you come into the hospital. That would constitute a second-degree burn. We really think that folks should be, evaluated by either emergency room or ourselves in the burn unit here at the trauma center to be able to actually have that wound get evaluated, because very quickly that break in the skin can actually lead to infection that could go down a different pathway and can cause great harm to a patient. By seeking care, a lot of times we can actually just get simple, second-degree burns to heal, but by it getting infected, sometimes that could then become a third-degree burn that might end up needing a skin graft. And so, realistically, if you even have a question, we're here 24 hours a day, 7 days a week, to provide care to the community and beyond, and we want to be able to service everybody. And if you even have a question about your wound, we'll gladly see you here in our emergency department or in the burn unit.
We know though that a lot of people, you'll get, a small blister from a sunburn. If, are you saying obviously we should not pop that, right?
Well, again, we're blister rupturers here, and so that's been the big debate for years and years. If it's something small, I would say, don't rupture it. If it's on a palm or on the sole of a foot, especially on a pediatric patient, it'll just give them some comfort and minimize their pain. If it's anything bigger, again, it should be looked at in the hospital setting and be evaluated so that we can get the appropriate antimicrobial creams or, some of our silver dressings that minimize the need to do a lot of dressings on a regular basis that will reduce their pain. We can give them pain medications to help facilitate, comfort. And then also, if they're a bad enough burn, we'll admit them into the hospital and manage their wounds to try to prevent them from having any need for skin grafting or beyond.
Dr. Schindelbeck, speaking of children, babies can be especially vulnerable. You mentioned that to the temperatures, but they can't always communicate their discomfort. How should parents know that their child may be overheating?
Yeah, great question. Again, children can't tell you, especially the infants, that they are suffering from heat exhaustion. So things to look out for. And we always say that parents know their children best. So trust your instincts. If something doesn't look right, believe that and seek help if you need to. So signs of a child suffering from heat exhaustion. Again, early signs would be they're going to be very sweaty, cool and clammy to the touch, very pale. It might be something as simple as you notice their heart's beating fast or they're breathing more quickly than you normally would recognize. Those are all signs. Irritability, crying a lot, fussiness that you can't explain. They're either wanting to take in a lot of fluid, right? They're trying to eat more, or they're vomiting. Those are all concerning signs as well. And then as the heat exhaustion progresses, you would start to look for signs of what we call lethargy in a little one. They're hard to arouse. They're not acting themselves, or they start to get really dry to the touch or appear really red and flushed. That would be a child advancing from heat exhaustion into outright heat stroke, and they need immediate medical attention.
Thank you. Dr. Poulikitis, back to you. What's the biggest mistake you've seen with patients who are using fireworks at home?
Probably thinking that they have any kind of control over the device or the implement. They're very unpredictable. Sometimes you think they're misfiring and they're a dud, so to speak, quote unquote. And then what happens is somebody wants to go over and look at the firework or go over and approach the firework, and then it explodes in a delayed fashion. That can cause injuries where you can lose fingers, toes, all whole limbs. And we've also had even, life threat where, folks have been even decapitated. And so we really don't want to see any such injuries. We want everybody to be able to enjoy the holiday. And so realistically, it's that lack of control on these devices. The other thing everybody wants to do is they want to hold the firework till the very last minute and then kind of toss it into the air. Once again, you rupture eardrums because it's in close proximity to a large group. You have, significant injury from the blast effect of the firework. And so, there's just such a huge unpredictability. That's why, all the communities have the professionals, putting on fireworks shows. They've done it for years. That's all they do year round is, practice and protect themselves and ensure that, they're at a safe distance from the firework. And so realistically, that unpredictability, and then you mix it in with alcohol and drugs, it really makes it a very dangerous proposition for the people who are trying to use them in
Absolutely.
holiday.
The last question I have for everybody. Dr. Joshi, we'll start with you though. What is your top summer safety tip for listeners?
Thanks again, Kate. I'm going to end with just a note about measles. I want to make sure all your viewers know that they are fully vaccinated with 2 doses of MMR. If you're unsure about that, you can check your own status using the IDPH Vax Verify tool that was widely used during the COVID pandemic. You can also talk to your healthcare provider. And if you're unsure, you can get a blood test to determine if you're immune and potentially get another dose of MMR. I will say that Cook County Health does offer vaccinations. You can call the Cook County Health Express Care number at 312-864-1111 to make an appointment. Just some other considerations. If you were vaccinated between 1963 and 1967, you may be eligible for revaccination. So that's something you should talk to your healthcare provider about. And again, you may also be eligible to have a blood test to confirm that immunity. Thanks.
Dr. Schindelbeck?
Yeah, I think, in Chicago, we all suffer through the winters in order to get to the summers, and we want you all to enjoy summertime here. It's what makes this city so great. I think, trust yourself, listen to your body. If you start to feel really thirsty or hot, you're probably already going down that spectrum of heat exhaustion. So get out of the heat. Learn how to recognize the signs in the people who are around you, right? If something doesn't look right, people start to act, again, stuporous, appear intoxicated, hot, dry, just abnormal. You got to get them out of the heat and treat them immediately. And that's when you call 911. While you're waiting for the ambulance to show up, or if you're in the early stages of heat exhaustion, first and foremost, get out of the heat, right? Get somewhere cool, wherever that is. If it's, your house, stay inside. If you're out on the job site, people need to work during the heat. Take breaks, get into a car with AC or a trailer, just get cooled down. things you can do if you recognize somebody in heat exhaustion or heat stroke, besides pushing fluids if they're alert enough to drink fluids. If you have a spray bottle and a fan, just mist them down and get the fan blowing. If they're in outright heat stroke, get them in cool water. That's very important. You need to get that body cooled as quick as you can. Heat comes in waves. So when it's not super hot out, plan ahead, right? These are times to make sure your HVAC system is working, change your filters at home, whatever you needed to do. If you don't have air conditioning at home, find friends and loved ones who might, where you can go during the peak hours of the day when it's really hot, or know where your cooling centers are. You can go on Cook County, their website, look for all the cooling centers in the area. It's very important if you don't have access to get somewhere cool at home, know where those cooling centers are. And then make sure if you're one of those individuals who have a chronic underlying condition that we talked about earlier, make sure you have your medication, right? If you find yourself running low and a heat wave's coming, that's the time to go see your doctor ahead of time, so you have all of your appropriate medicine, so you're not putting yourself at risk from the heat.
And Dr. Kouloukidis.
Well, as Dr. Schindelbeck said, we have a wonderful city here and there's lots of services. And I feel that we provide such excellent care here at Cook County Hospital. Three things that we see that are great concerns for us through the summertime. One, starting barbecues at the beginning of summer, right? Some of those barbecues are just not in working order and they may explode. And so we see barbecue injuries from that perspective. Obviously, we're coming on fireworks season. And so that's another concern that we have. The third that a lot of people don't think about in the city, but we see a lot of the burns here in the burn unit is that in some of our rural areas, a lot of people don't have the means to dispose of trash appropriately or even leaves. And so they burn those trash and leaves in their yards. And again, that fire, just like the firework, is so unpredictable and can cause folks to sustain very severe injuries. And so we just want everybody to be safe. We want everybody to be able to enjoy their environment. We want everybody to be with their loved ones and family. We are here, though, as Dr. Joshi and Dr. Schindelbeck said, to be able to service the community here at Cook County. And if anybody has anything that they even are concerned about as an emergency, obviously they can be seen in our emergency department here or in our trauma bay. If there is a great concern, even some of our referring hospitals can call our trauma bay at 312-864-1000 and get at least some direction as to where to go in terms of for care or how to be seen more appropriately and quickly. We also have a clinic 5 days a week here at Cook County for the burn unit, and our burn clinic provides care. And we see folks from all over the region as far as into Wisconsin and Indiana and even Iowa. And so we're more than willing to be able to help service the community and be here as a resource for them. We hope we don't have to see anybody, but we're glad to care for them because we want everybody to enjoy their holiday.
Thank you for all that you guys do. I'd like to thank everyone for joining us today. We want you to have a safe and healthy summer this year. So if you need medical attention, regardless of your ability to pay, Cook County Health is here for you. Thank you to our doctors for joining us and sharing their tips. We want you to stay safe, stay hydrated, and enjoy your summer. And we'll see you next time. Thank you.